So next we shall talk about ossification. Ossification is the process of laying down a new bone material by cells called as osteoblast. So osteoblasts are rapidly dividing cells which divide themselves and form later on into osteocytes, which are matured bone cells. And there are two types of ossification. One is the membranous ossification or intramembranous ossification, and the second type is the cartilaginous ossification or endochondral ossification. So intramembranous or membranous ossification is the direct laying down of the bone into the mesenchyme. So here in first image we can see mesenchyme is present, which is an embryonic connective tissue, and mesenchyme forms a layer first. Within the layer we see directly the bone cells start forming osteoblast, and they develop and they form matured into osteocytes and form like layers along with the ground substance, and later it gets calcified. So this is what about intramembranous ossification. Endochondral ossification involves the osteogenesis, which makes a precursor model of cartilage. So first the cartilaginous model is laid down. Later this cartilaginous model, the cartilage is replaced by bone, that is endochondral. So first we are here to see the membranous ossification, which is otherwise called dermal ossification or intramembranous ossification. So these dermal bones, they ossify in intramembranous ossification, and thus they are derived from the mesenchymal condensation. So here I said earlier the mesenchyme is laid, which gets condensed to form the bone. So the flat bones of the skull and face and even the part of the mandible and part of the clavicle develop from intramembranous ossification. So that is about intramembranous. On the other side, this side we can see this is cartilaginous ossification, where the cartilage model is that the blue one is the cartilage, and slowly it is replacing to form bone. It gets calcified cartilage becomes bone here, and we can see the osteoblast forming osteocytes, and slowly the chondrocytes are replaced completely. And avascular tissue, the cartilage is an avascular tissue, whereas the bone is a vascular tissue which has got its own neurovascular supply. So we can see it becomes vascular from avascular. So the bones of the extremities like upper limb bones, lower limb bones, and which those present in the axial skeleton that bear weight, even including the vertebral column, thoracic cage, all these develop by endochondral ossification. And there is a third type of ossification called as membranocartilaginous ossification. Means the part of the bone develops from cartilaginous model, where the cartilaginous model is placed first and then it gets turned to form a bone, that is called as endochondral. And whereas the part of the bone develops by membranous ossification. So if a single bone develops by two varieties, it is called membranocartilaginous ossification. The best example is mandible. So mandible and also the clavicle, occipital bone, temporal bone and sphenoid bone. So these are the examples of membranocartilaginous ossification. So that was about the ossification of long bones. So let's see the each time period and bones get affected. So second month of fetal development, the ossification of long bones usually begin, and fourth month most primary ossification centers have appeared in the diaphysis. Usually we say during 6th to 8th week of intrauterine life we see the appearance of all primary centers. The first one to start ossify is the clavicle. So the primary ossification center for the clavicle, it appears during 6th week of intrauterine life. And birth of to 5 years, the secondary ossification centers will appears in all the epiphyses, and 5 years to 12 years in females and 5 to 14 years in females, the ossification is spreading rapidly from the ossification centers, where the bone becomes ossified and starts growing, and 17 to 20 years the bones of upper limbs and scapula becomes completely ossified, and 18 to 23 years the bones of lower limbs and ox coccyx becomes completely ossified. That is, hip bones will get completely ossified and femur as well. Then 23 to 25 years, the bones of the sternum, clavicles, vertebra becomes completely ossified, and by 25 years, nearly all the bones will be completely ossified. So this is the age-wise how the ossification gets affecting different bones in our body. Next, about the growing end, which is very important clinically. So here we can see the image, the direction of growing end. Always the growing end is towards the elbow in the upper limb and away from the knee in the lower limb. So this shows the direction of nutrient artery. I said already the nutrient artery is always directed opposite to the growing end. So the growing end is opposite to the nutrient artery direction. So the growing ends of the long bones in the upper limb, the upper head of the humerus, and the lower end of the radius and ulna in the upper limb. In the lower limb, the lower end of the femur and the upper end of the tibia are the growing ends. The nutrient foramen is directed away from the growing end of the bone, and their directions are indicated by, you can remember as towards the elbow and flee from from the knee I flee. Next we shall discuss about blood supply of a long bone, which is also clinically quite important. The nutrient artery enters the diaphysis. So here is the nutrient artery which is entering the diaphysis, that is the shaft, through the nutrient foramen, and it runs obliquely through the cortex where it is directed away from the growing end of a bone, and it is descends into the medullary, and further it gives rise to ascending and descending branches. So we can see here these are ascending branches and descending branches which are given off in the medullary cavity from the nutrient artery. And each branch, we can see it divides into a number of small parallel channels which terminate in the adult at the metaphysis by anastomosing with the epiphyseal and metaphyseal and periosteal arteries. So here the epiphyseal plate is there, the growing end here, the cartilaginous plate is there. We can see the metaphyseal artery forming hairpin bends. We can see they are forming the hairpin bends. So increasing the vascularity to the growing end. And but clinically this part may often gets infected, prone to infection, because the blood pools there for a longer time. So if pooling of the blood is more, so there is a chance of spreading infection also more in that metaphyseal area. So it supplies the medullary cavity, this nutrient artery, and then it gives rise, and inner 2/3 of the cortex also it supplies, and it supplies the metaphysis. The nutrient foramen is directed away from the growing end of the bone. So memory, how we remember, towards the elbow I go and from the knee I flee. That is the direction of nutrient artery. So here we can see the epiphyseal artery entering into the epiphysis, upper end and lower end, and this is the epiphyseal cartilage. This is the epiphyseal cartilage, this blue color, and these are the periosteal arteries, which are small branches, which are direct branches from the surrounding arteries at the periosteal arteries. So here in this image we can see the direction of the nutrient artery. They are towards the elbow, just opposite to the growing side, and away from the knee. So to memory, towards the elbow I go and from the knee I flee. So that is the direction of nutrient artery. So that was a little introduction about bones. So let us discuss with few questions. So the bones ossified at birth except lower end of femur, calcaneum, upper end of tibia, upper end of humerus. Which would be your answer? So the secondary centers around the knee joint, that is the distal femur and the proximal tibia. That's how you have to remember. So the answer is here the upper end of the humerus. So why the answer is the secondary centers around the knee joint, that is the lower end of the femur and the upper end of the tibia, they appear during the last weeks of intrauterine life or immediately after birth. So the primary center for all the tarsal bones except the talus calcaneum and cuboid appear after birth. So that is the reason upper end of the humerus it appears after birth. And here it divides into ascending and descending branches and which run towards and terminate the adult metaphysis by anastomosing with the epiphyseal and metaphyseal and periosteal arteries. So that is about the nutrient artery. So the answer is towards the metaphysis. So this completes introduction of bones. I hope you understood this topic. Thank you.